Good evening, everyone. A very warm welcome to Liver Cancer Awareness Month, a nationwide public health campaign organized by Voice of Healthcare in collaboration with Isar Pharmaceuticals. I'm Dr. Muskan Ahlawat on behalf of Voice of Healthcare, and I will be leading today's discussion. It's an honor to have all of you joining here, showing your interest in understanding and protecting one of the most vital organs in our body, the liver. Liver cancer remains one of the most overlooked yet serious health disease of our time. It is often referred to as silent killer. It tends to progress unnoticed with few or no symptoms in its early stages. By the time it is detected, the disease has already been advanced, making treatment more complex. The liver is a powerhouse organ. It filters toxins, stores essential nutrients, aids in digestion, and regulates metabolism. When its function begins to decline, the impact is felt across the whole body system. It is an era marked with sedentary lifestyles, changing diets, increasing alcohol intake, and rising viral infection. The burden of liver disease and liver cancer is growing steadily. This makes awareness, timely screening, and preventive actions more critical than ever. Today, we are extremely fortunate to have Dr. Varun Goel, Senior Consultant and Principal Coordinator, Take Care Service, Medical Oncology at Rajiv Gandhi Cancer Institute and Research Center, New Delhi. Sir will help us understand the basis of liver cancer, how lifestyle and diet affects liver health, and provide some medical advice for protecting our liver. So, without further delay, let's welcome Dr. Varun Goel for our session. Hello, sir.
Hello. So, thank you, Dr. Muskan, and warm greeting to everyone joining us today. I'm really glad to be part of this conversation because, as you have already told, that liver health is something we often overlook until it's too late. So, liver is a silent worker. It doesn't complain, it doesn't hurt, yet it performs over 500 vital functions every single day, and some of which you have highlighted already. With the festive season around the corner, full of rich foods, sweets, and celebrations, this is the perfect time to understand how our lifestyle choices affect our liver and how we can prevent serious problems, including liver cancer. So, let's begin by understanding why the liver is such a vital organ.
Sir, to begin with, can you help us understand why the liver is considered such a vital organ in our body and how it plays role in maintaining the overall health?
Yes, obviously, that's the first question, and that's a great question. We should start why it is important to discuss liver and in this important forum. So, liver is often called chemical factory or detox powerhouse of our body, and that's no exaggeration. Think of the liver as a multitasking control center. Everything we eat, drink, or even breathe in is processed or filtered by the liver only. And we can break this down simply like few important highlights of liver functions. It metabolizes nutrients. So it converts food into energy. It stores glycogen, that is mainly body's sugar bank, and it regulates glucose levels. It detoxifies harmful substances that may be from alcohol or medicines or environmental toxins. So it detoxifies harmful substances. It produces bile, and it is very important for digestions because it digests fats. Liver stores essential vitamins like A, vitamin D, E, K, and also important mineral like iron. It helps to regulate blood clotting and it prevents excessive bleeding. It supports immunity by acting as a frontline defense filter for infections. So, yes, by all these points, I may say an emphasis that in essence, if the liver isn't healthy, nothing else in your body works properly. And the remarkable part is, liver can regenerate itself. Even if part of it is damaged, it can rebuild, but only up to a point. If the damage keeps happening, liver loses its ability. That's why It's so crucial to protect it before the damage becomes irreversible.
Thank you so much, Dr. Varun, for breaking this so easily for us that why liver is so important. So, sir, moving ahead, we would like to understand that what exactly is liver cancer and what are some early signs and symptoms of liver cancer?
Yes. So, being a medical oncologist, obviously, it is my forte. So,
Yeah.
I just like to highlight why liver cancer is important, and what is other name is hepatocellular carcinoma. So, liver cancer or hepatocellular carcinoma, it develops when normal liver cells start growing uncontrollably. So, tragedy is that most liver cancers are detected late because the liver doesn't send early warning signals. Many patients come to us when the tumor is already advanced.
Mhm.
So what are the early warning signs? Those signs which normal public, normal people, or maybe high risk patients should never ignore. So, among those warning signs are, first one is unexplained weight loss or persistent fatigue, loss of appetite or early satiety. That means feeling full even after small meals. There may be some pain or fullness in the upper abdomen. Otherwise, swelling of the abdomen. That may be because of the fluid accumulation in the tummy, that also called ascites or peritoneal fluid. There may be jaundice, that is yellowing of the eyes and skin and urine, dark urine or pale stools. And because of this jaundice, there may be persistent itching and there may be some swelling in the legs. So these are some warning signs which says that liver is not functioning properly, and there may be some liver cancer, hepatocellular cancer may have developed on that cirrhotic liver, damaged liver. But here's the challenge. These symptoms can also occur in non-cancerous liver disease also. If liver is damaged, that is cirrhotic liver, these symptoms happens. So not all cirrhotic livers harboring liver cancer. Few percentage of liver cirrhosis only will develop liver cancer. But still, if these signs, early signs are there, then especially if patients are with risk factors like chronic hepatitis B or C,
Mhm.
cirrhotic fatty liver, heavy alcohol use history, those patients should undergo regular screening even if they feel fine. And what is the screening method? We often recommend that an ultrasound every 6 monthly and a simple blood test, that is alpha fetoprotein. It should be done every 6 monthly, especially in the high risk factors. Otherwise, in a without high risk factor, if we doesn't know about the cirrhotic stage of our of our liver, if we are morbidly obese or diabetic diabetic patients, then as such, at least at the time of early signs, we should go to a doctor to thoroughly checking, and that will save that. In that case, we may found these tumors in early stage so that we can cure those.
Sure. Thank you so much, sir, for highlighting the early warning signs for liver cancer and the risk factors that one should be aware of. So, sir, as a medical oncologist, what would you say that how common is liver cancer in India? Are there any particular age groups or gender that are more affected with this?
So in India, liver cancer is, I may say, not among the top five cancers, but its incidence is steadily rising. So and because per year its incidence is rising, that is concerning. So there may be several reasons behind the rise of this liver cancer incidence. So there are some high risk patients, like because of the chronic viral hepatitis, especially hepatitis B or C, and these infections, these viral infection can cause long-term inflammation and scarring of the liver, and then to extent liver may regenerate, but after that liver may go to cirrhotic stage and later may develop hepatocellular carcinoma on those cirrhotic liver. Another risk factor is alcohol related liver disease. And third, and I may say should have enumerated this third risk factor at the first only, and because it is a rapidly rising cause, that is non-alcoholic fatty liver disease. Nowadays, it is the first common risk factor, first most important risk factor to development of the liver cancer. It is emerging as a silent epidemic due to sedentary high lifestyles, obesity, diabetes, and overall metabolic syndrome. Fourth, but not less important, it is a alpha toxin exposure. It is a toxin which have been found in improperly stored grains or nuts in some part of India that also may cause liver damage and cirrhosis and later development of the HCC. If I may say, as you have asked, what about the male female ratio, whether male are more affected or females? So, overall, it has been seen that men are more affected with liver cancer than women, and roughly ratio is 3:1 ratio. If three males are affected with liver cancer, then one female is also affected, and its usually presentation is 40 to 50 years of age. Eastern and northeastern regions of India, they report more cases of hepatocellular carcinoma due to higher hepatitis prevalence. So, what's alarming is that urban, middle aged adults who may not drink alcohol are now being diagnosed with fatty liver and even cirrhosis due to poor diet and inactivity. That's what I'm saying, that initially it was more common risk factor and causes of hepatocellular development was hepatitis B and C infection and alcohol intake. But nowadays, even non-alcoholic and in urban areas without hepatitis B or C infection, still, because of the poor dietary habits, poor lifestyle habits, inactivity, obesity, and maybe development of diabetes, those patients also are having non-alcoholic fatty liver disease, and then those may develop cirrhotic liver and may develop hepatocellular carcinoma. So overall, it's not just a disease of drinker anymore; it's a disease of the modern lifestyle. And positive side is that most risk factors are modifiable. If we would have been aware of these risk factors, maybe we will act on that. So if we control hepatitis, alcohol, obesity, and diet, we can dramatically reduce the liver cancer burden.
Correct, sir. I agree with you that controlling ourselves would only protect us from these type of diseases. So, sir, as you were mentioning about lifestyle, food habits, alcohol consumption. So, my next question is related to that. Are there any specific foods or nutrients, or there are many supplements nowadays, which can actively support liver health or potentially reduce the risk of liver disease?
Yes, obviously, lifestyle changes is the one of the most important point which are modifiable, which we can modify accordingly to reduce the risk factor. So, dietary choices matters most, and liver health depend on what we feed it. So it is literally, and simple guide is, first one I may say, we should eat rainbow. Rainbow is colorful fruits and vegetables like spinach, beets, carrots, berries. These all are packed with antioxidants and that can protect liver cells from oxidative damage of the daily basis damage from the fat in accumulation or hepatitis, viral infection, or alcoholic damage. So we should eat rainbow. We should eat whole grains over the refined carbs. We should choose either brown rice, oats, millets. They help to regulate insulin and reduce fat built up in the liver. We should avoid refined carbs. Third is protein. What about protein? So we should prefer lean proteins like fish, lentils, eggs, paneer, tofu. We should avoid red and highly processed meats. Fourth is about the fat. So regarding fat, we should take good fat. So we should use olive oils, nuts, seeds, avocado. We should avoid trans fat, deep fried items, and highly processed snacks like chips and packaged foods. Regarding next point is hydration. So it is also a very important point, and we should drink adequately water throughout the day. So liver needs to flush toxins efficiently. That's why adequate hydration is important. Next is we can limit sugar because
Hmm.
excess sugar converts into fat in the liver and that may worsen fatty liver. So it's not just we to avoid fatty liver we can avoid fat. If we take extra carbohydrates, extra sugar, then also will convert into the fat. That also will increase fatty liver. So we should skip colas and these cold drinks and packaged juices. Next point is coffee. It is it is good if we take in moderation. Study shows that 2 to 3 cup of a day of coffee can lower the risk of cirrhosis and liver cancer. But obviously, it should be with less cream and less sugar.
Hmm. Yes.
Otherwise, that will not solve the purpose. You have asked about the supplements. Yes,
Hmm.
regarding supplements, we should be cautious. Many herbal liver tonics and detox powders, which are available over the counters, can actually harm the liver because there may be some preservatives, there may be some heavy metals, some toxins. So daily use of those are not recommendable. Always we should check with our doctor whether whichever uh, tonic we are taking is like okay with for the liver health or not. And last but not the least, a brisk 30-minute walk daily can cut fatty liver risk by 40% because it is important. I am saying that most common risk factor nowadays is metabolic syndrome, obesity, and diabetes. For that also, it is recommended already by the higher authorities and FDA and all the doctors that brisk 30-minute walk can decrease our obesity, can improve our insulin sensitivity, can improve our diabetes control, and overall can improve our fatty liver, and then can cut risk of hepatocellular carcinoma development also. So overall, to summarize, I may say that mantra is simple. We should eat fresh, we should move more, we should drink water, and we should skip excess. We should not feel even after feeding sufficiently.
Thank you, sir, for these practical tips. We are, very encouraged to know that certain foods or nutrients can actively support our liver health, and I'm sure that audience will also must find this very useful. So, sir, we know that festive season is coming. Diwali is coming. So, over Diwali, we have a tendency that short periods of indulgence of fast food, alcohol, can these also cause long-lasting liver damage, or liver is resilient if we take our health very seriously the next day?
So obviously that is a very important and relevant point question, which obviously everyone asks nowadays, and everyone hope that I should answer a yes. Yes, I can answer yes, but to an extent, because liver is remarkably resilient. So to some extent, we can enjoy ourselves. We can take sweet dish and all, but if you overeat or drink a little during the festival only, and then return to your healthy life habits, then it's okay. Your liver can recover. But here's the catch: repeated overindulgence and binge drinking can cause fatty changes, inflammation, and eventually scarring and fibrosis. So over time, this leads to cirrhosis, and that's when the damage becomes irreversible. So here also I may give some practical tips. Um, we should drink plenty of water between meals if we are consuming alcohol, and we should include salads, fruits, curd in our festive spreads. We can avoid mixing alcohol with sugary beverage because it doubles the harms. We can try portion control, taste everything but finish nothing. We can give liver a detox day after celebrations. That day, maybe just after Diwali or maybe after overall celebrations. So we should eat light, we should hydrate, and we should take rest. So festivities should bring happiness, but not hospital visit, obviously, and enjoy them mindfully because a healthy liver means healthy celebrations next year too.
Correct, sir. It's true that celebrations are important, but so is moderation and post festival care. So, Dr. Varun, on that note, before we wrap up our discussion, let's move on to a quick myth versus fact segment where we will discuss some of the most common misconceptions around liver health. So, sir, first notion is that you were also mentioning about liver function test. So, sir, if someone is going through LFTs and then they are normal, so it means you are safe from liver cancer, or it is a myth?
So obviously it is a myth. Just by blood liver function test, we can't say that I am safe. It is not true because if in early liver cancers, LFTs can remain normal. It's just like that because liver is resilient, liver is regenerative. Up to some extent, if liver is damaged, the remaining liver is sufficient to show normal liver function. It's just like that. If we have, obviously we have two kidneys. If one kidney because of some reason have been damaged or have been donated for transplant to our near and dear, even then one kidney is sufficient, kidney function test will be okay. Same here, if even significant portion of the liver damage, still liver function test will be normal. That's why if just LFT is normal is not that our liver is normal. If we are at risk, we should also do ultrasound and AFP test regularly. In high risk patients, maybe 6 monthly, especially after age of 40. In otherwise, maybe once a year, at least after 40.
Thank you, sir, for highlighting about diagnosis. That is much more important. Second would be that there is a common notion that liver cancer treatment is, surgery is the only option that we have. So, can you highlight some more treatment options that are available nowadays?
Obviously, it is also a myth and it is also false. It is not like that only surgery is the option. It is a multidisciplinary approach to treat liver cancers, and there is very recent advances have happened in this area. Nowadays, first of all, we usually stage our liver cancer patients as like liver cancer is localized or advanced, limited to liver only or outside liver also. After staging, we see what is the remaining liver function, and obviously surgery is a gold standard, but that is not only option. So if surgery is not possible because of some reason, then in locally advanced tumor, we may go for some form of ablation, that may be heat or cold or radiofrequency ablation to destroy those cancer cells. Otherwise, if even ablation is not possible, maybe lesions are more than 3 or 5, maybe size is like that, that ablation is not possible, but still mainly disease in the liver only, then next option is we can go for TACE or TARE, that is trans angioembolization, trans arterial angioembolization or chemoembolization. So we can block blood flow to the tumor, and that can reduce the tumor size, and it is very effective for the liver only or mainly liver burden disease. Next comes to, these are all local therapies. Next come to systemic therapy. If even after these local therapy, or if these local therapy are not possible because of the disease burden, and maybe disease in is beyond the liver also, then system therapy in the form of target therapy, immunotherapy are the options. Nowadays, I remember maybe a few years back, we don't have access to immunotherapy, only target therapy in the form of sorafenib was available, but that drug was toxic, so most of the patients were not tolerating that drug. But nowadays we have another target therapies like lenvatinib, that is very good and effective drug. Otherwise also regorafenib, ramucirumab, all these drugs are there as a target therapy, and mainly these are tablets only, with patient comfort, they can take at home only, no need to admission also. Otherwise, nowadays recent most recent advance is immunotherapy and immuno combination and immuno target therapy combination. So these immunotherapy can help body immune system to fight cancer. So obviously these are not chemotherapy. Usually chemotherapy doesn't work in liver cancers. So there is in immunotherapy, effectivity is very good. These are very effective drugs without the with the toxicity of chemotherapy. So, and in very few selected patients, obviously liver transplant is also an option till now. So I may say each and every patient of liver cancer we usually discuss in our multidisciplinary tumor board, and there medical oncologist, surgical oncologist, radiation oncologist, and senior radiologist, intervention radiologist, pathologist, and these all these are there, where we can check out all full plan of each and individual patient and go accordingly, because it's not one size fits treatment for all. It's not anymore like that. It's not that surgery is the option. We have powerful new tools, especially immunotherapy, which is changing survival outcome dramatically.
Thank you so much, sir, for clarifying these myths. And I must say that we have a wide range of treatment facilities nowadays. So before we end, any golden tip that you would like to give us to follow for our good liver health?
Yes. So obviously, I would like to leave everyone with one thought that your liver protects you silently. It never complains, but it remembers everything you eat, drink, and expose it to. So be kind to it. Avoid unnecessary alcohol or self medication. Get vaccinated for hepatitis B, or maybe you have already vaccinated, but maybe not properly. Check for anti hepatitis B antibodies, whether those are sufficient or not. Maybe you need to have booster dose for hepatitis B vaccine. You should screen regularly, if at least if you are diabetic, obese, or if there are any family histories there. And celebrate life, but celebrate responsibly. A healthy liver means a longer, more energetic life. So this is my take home message, I may say, with this discussion.
Thank you so much, Dr. Varun, for sharing valuable insights with us. And I hope we are all aware of Liver Cancer Awareness Month. And surely we'll follow the practical tips that you suggested today. Thank you so much, sir.
So thank you, VOH, and thank you, ISAI India, for organizing this initiative. Thank you, everyone who have joined and who will listen this later. And
Thank you. Thank you so much, sir, for joining.
stay healthy, stay mindful, take care of your health.